The United States is the most dangerous country for a Black mother to give birth in the world. That's not a joke. That's the truth. Why is that? Well, the disparities come from decreased access to high quality healthcare, systemic racism, and implicit bias. Hello, everyone. I'm so happy to be here. My name is Jade Kearney, and I'm the CEO and co-founder of She Matters. This is a picture of me. This is a picture of me all dolled up. About 8.5 months ago, I was pregnant with twins. My pregnancy went well. I had competent healthcare providers, and on January 5th, I gave birth to 2 healthy baby boys. These women who look like me, who are the same age as me, and have the same educational background, unfortunately, did not bring their children home because they all died due to Black maternal morbidity. I want to zoom in on April Valentine because we were pregnant at the same time, and she died due to medical neglect. I found myself constantly wondering, why was I afforded life and they were not? Was it because of the staff and the physicians that I chose? Was it because of the resources that I have? Or was it because of the support that I had? About 5 years ago, I decided that I wanted to make sure that none of those were the reasons why Black women would die during their postpartum period. And I would create a space where all of the resources and all of the physicians that are culturally competent there would be a place where all the physicians and all the resources would be for physicians who are culturally competent and for Black women to access them. And that's why my co-founder, Marguerite Pierce, and I created She Matters. She Matters is a digital health platform designed to support Black mothers by providing them with community, culturally competent healthcare providers, and ethical resources. What's the problem right now? The United States is the most dangerous country for a Black mother to give birth in the world. That's not a joke. That's the truth. Why is that? Well, the disparities come from decreased access to high quality healthcare, systemic racism, and implicit bias. Years ago, it was thought that the reason why there were such high Black maternal mortality rates were just due to socioeconomic factors. With a study that came out in the beginning of 2023 that said it didn't matter what the educational background of a Black mother was, she would receive worse care than the poorest white woman in the United States of America. The cost of unequal care is tremendous, over $31 billion. Maternal mental health conditions cost upwards of $18 billion and is the top reason for medical costs. High readmission rates during postpartum periods and hypertension are also reasons why Black maternal morbidity costs hospitals tremendous amounts of money. Our solution is pretty simple. 3 C's. Culturally competent healthcare providers trained with our certification, culturally relevant resources, and community. Our product is simple. She Matters developed an ecosystem of effective solutions for healthcare providers to manage their education and a trusted community of Black mothers on our She Matters community app. For women, we offer community. One thing that I experienced with my first child was I felt alone. I felt neglected by healthcare providers, but I also felt alone due to cultural stigmas around mental health and postpartum and pain. So we have a community where Black mothers can validate their experiences during their postpartum period. My co-founder often says that people can find more information about the postpartum period of animals than Black mothers. That's why we have a hub of culturally relevant resources created by maternal health experts available for Black mothers 24 hours a day, and culturally competent mental health and healthcare professionals, a directory full of culturally competent healthcare professionals who understand the specific nuances related to Black mothers. She Matters is the only digital healthcare platform that offers a culturally competent certification tailored to the specific nuances and challenges related to Black women. We reduce postpartum maternal mortality statistics, increase return visits for Black mothers, and improve the patient-provider relationship through our culturally competent certification. The market is vast. We're a part of the maternal health care market, we're a part of the behavioral health market, and we're a part of the data market. Why now? Only 18.7% of physicians are required to complete cultural competency certification. 77% of physicians had no knowledge of national healthcare equity standards, and 40% of Black mothers who suffer from maternal health conditions are never treated. Awareness of racial injustice is on the rise in America, bringing with it the harsh reality that Black women are not receiving equitable maternal health care. Why do hospitals care? I would love to tell you that hospitals only care because Black women are dying. But HCAHPS scores and high readmission rates are heavily affected by Black maternal morbidity as well. I always say there's enough Black maternal mortality to go around, and I don't view anybody as competition because this problem is vast. But here are a few contenders that actually do similar things that we do. What they're missing is the double side of the coin. We not only are a provider for Black mothers, but we're here for healthcare providers as well. We want to make sure that not only Black mothers feel supported and safe, but healthcare providers feel supported and safe. This year, we've signed several contracts with 3 university medical hospitals. We're right on target with our financial projections that we started at the beginning of 2023. Our team comes with a wealth of knowledge. In addition to Marguerite and myself, who have experienced postpartum comorbidities as Black women, we have Alexander Packard, Isaac Cotto, and Eric Reese, all who have a deep knowledge of venture in healthcare. Our traction is 10,000 Black moms that are a part of our community, 3 hospital networks, and 5,000 healthcare providers, all certified as culturally competent. Our ask is simple. We're asking for DE&I professionals, introduction to DE&I professionals at medical and nursing schools, Medicaid programs focused on maternal health care, and angel investors passionate about the maternal health care space. I would love to say, if you're interested in speaking with us about opportunities and connections, contact me. But if you know a Black mother please share She Matters with her, because she may be suffering in silence. Thank you so much.
Just a quick question, what do you think allowed you to make those first sales to hospitals? What was the convincing argument that you gave to finally get people to pay attention to what is a national problem?
I really think it was the research that came out in the last 2 years. We've seen a huge change in the amount of interest that hospitals and medical schools have taken, because research says this is a problem, but this problem can be fixed, right? With education. I write down every time a customer says the same thing, right? People say this is a problem and we don't know what to do. So we're a solution when customers say we don't know what to do, because we don't know what to do. But this is a solution. This is a starting point.